Hello guys, I'm Shanmugapriya, your lecturer from SNS College of Allied Health Science. So in the previous class, we have already seen a topic in osteology and it is the main bone in the forearm. So basically it is a radius. So in this class, we will be seeing another forearm bone. So that is ulna. Now let's switch to its partner, the ulna. So we are just going to see about the location as well as their anatomical position of the ulna. The ulna is the other long bone in the forearm on the medial side. Opposite to the thumb in the anatomical position, it parallel to the radius, extending from the elbow to the wrist, and its primary role forming the elbow joint and providing forearm stability. It articulates with the humerus proximally and forms the part of wrist distally plus muscle attachments. So now we are just dealing with the parts of ulna, so proximal end, and the proximal end features. So the proximal end features is olecranon, that it is the most prominent posterior projection forming the elbow. It's a point of your elbow. And also we have coronoid process. So this coronoid process is anterior projection that stabilizes the elbow bone. Elbow. And we have trochlear notch, which articulates with the humerus trochlea for the hinge movement. Hinge movement is that movement which shows flexion and extension. And then also we have radial notch. It connects with the radial head. And this end is all about elbow strength. And then we are just dealing with the parts of ulna in the shaft and distal end. So basically the shaft is a triangular with anterior, posterior and medial surfaces. It has a sharp interosseous border of the membrane attaching to the radius. In the distal end, the small head and styloid process. The ulnar head articulates with the radius and wrist bones. Styloid process attaches with the ligaments for the wrist stability. So next we are just dealing with side determination. So for side, the proximal or olecranon posterior, trochlear notch anterior, and the radial notch lateral. That is, it faces the radius. And also we have distal, which can be identified by the styloid on the medial side. And also we have shaft, which has interosseous border lateral. So next, regarding the ossification of ulna. So primarily we have two centers. So the primary center and the secondary center. So the primary center in the mid shaft at the 8th fetal week, and the secondary center the end or around the puberty. It closure, the proximal grows at the age of 16 years and the distal in 18 to 20 years. Delays could signal growth issues. And also switching to the blood supply, nutrient artery from the anterior or posterior ulnar arteries, periosteal from the ulnar artery, anastomosis around the elbow for backup circulation. And the applied anatomy is that the muscle attachments. So the muscles at the proximal is triceps brachii on the ocular foramen, brachial on the coronoid shaft, flexor extensors like flexor carpi, ulnaris, and pronata teres. Distal, we have pronata quadratus and wrist ligaments, which enables the rotation, flexion, as well as extension. So next we are going to see the clinical relevance. So that fractures. So the olecranon, olecranon forms the direct hit, the shaft from the nightstick, defense injuries, dislocation of the ulnar head in the wrist trauma, and also we have Monteggia fracture. So this ulnar fracture with the radial head dislocation. Ulnar nerve nearby fractures risk nerve damage. In the summary, we have medial So we have medial forearm bone for the joints. Parts we have oligron, coronoid, shaft, and head. Also we have styloid. It ossifies by age of 20 years, and the blood supply is ulnar and nutrient arteries. And in the clinical, we have fractures, dislocation, and nerve injuries. And then, so in next class, we will be seeing an interesting topic in osteology. And I think you are all aware of this topic, radius and ulna. Thank you.